maxilla for a concept. But which are the bases under this concept? For every technique, for the nasal anchorage, we have the nasal implant, specifically designed for this technique. For the zygomatic implant, we have two types of zygomatic implant that Matteo is going to re-explain to you. Okay. For the pterygoid implant, we have two types of pterygoid implant. So you understand that a technique is a technique, but for performing a technique, we need to have the right tool. Okay. Because, for example, like I was speaking with Matteo before, for a pterygoid implant, for a pterygoid surgery, we need to have a specific implant. We cannot put a pterygoid with high primary stability with a cylindric design. Okay? You understand? That is very important. In the mandible, we can do whatever you want with more or less all the implants because we have a high primary stability. In the maxilla is a totally different world because we are dealing with low density bones. That is our biggest challenge. When the bone is soft and with a finger you can create a hole, an osteotomy. So the first thing of maxilla for all is we study the case. And we check if there is bone in the pterygoid area. Why? Because, for example, Matteo showed you yesterday quad zygoma surgery. Very difficult, but he's one of the best in the world doing zygomas. Okay? But if we have a pterygoid, maybe we put a pterygoid with the Paga technique that I showed you yesterday. Maybe we add one zygomatic implant, not a quad. One zygomatic, and then two short implants in the front, okay? We are turning from a difficult situation into a simple one, okay? You understand? That's why we have always to start from the back, checking if there's the possibility to put a pterygoid. If we can't put a pterygoid, we check the bone into the anterior maxilla. If we have enough bone to perform a transsinus implant, like we are going to analyze the transsinus surgery. If we don't have bone at all in the premaxilla, we have to think about the zygomatic and quad zygoma technique. Do you agree, Matteo?
Of course. Please leave zygomatic rehabilitation like the last option. Okay? Because not because it's a difficult surgery, but because the complications are most difficult to treat. So please always try with another kind of implant. Leave the zygomatic implants only for very hard cases. Cases that you can't solve with traditional implant. And remember one thing that I spoke yesterday, that I told you yesterday, and that I will repeat today. The concept of maxilla for all concept is explained with this line. Always try to follow the pillar of the skull, the pillar of the face. This is the trick to get a success in the rehabilitation of upper jaw, rehabilitation of maxilla. The maxilla for all concept means follow the pillar. You always have to try to put one implant into the canine pillar. You can choose the low canine pillar in this part, or also transnasal. It's the same pillar, the canine pillar. Zygomatic is the last option when you have not possibility to do anything else.
Very good. So, which are the principles? No need of hard tissue rebuild. So, no need of bone regeneration. But why we are avoiding bone regeneration? Because it is a time-consuming procedure. When you do a GPR, you have to say to the patient, to tell to the patient, dear patient, I do the GPR. The GPR takes 6 months of healing. After that, we cross the finger. that everything is working. Because if you speak with the best regenerative surgeon in the world, they tell you that they have the 80% of success. The best, the best. I'm not the best, maybe I have 60, 65, 70% of success.
Then
Okay?
the best one, the master of the regeneration technique, make a good screening of the patient before to make the surgery.
Yes.
They screen the patient a lot with the cleaning, with the cleaning. My patient, I don't know your patient, but my patient, are patients that wash their teeth when they remember, sometimes once a day, maybe. Patient that smoke a lot. It's very difficult to change the attitude of our patient. It's very, very difficult. So we have to try to make treatment that our patient can receive in order to don't create other problems. First things, it don't create other problems for our patient.